over 18% of our GDP on healthcare. That is almost double what any other country spends. And as broken as our general healthcare system is, it seems to me that our primary healthcare system is even more broken, with tens of millions of people not able to get to a doctor when they get sick. And I have talked to physicians in Vermont and around the country who tell me that people walk into their offices very, very sick, and sometimes with incurable illnesses that could have been dealt with if they walked in the door on time. And they didn't because they didn't have insurance. They were embarrassed not to have any money to pay. In your judgment, number one, would, at a time when we spend so much more than other countries on healthcare, if we provided at least primary healthcare to every man, woman, and child, we've had primary healthcare accessible to everybody, in the long run, would it save our healthcare system substantial sums of money? Ms. Veer, you're jumping to answer that?
I am, Senator. Thank you so much for the question. And I would say yes, maybe. But because the maybe is you also need to make sure that they not only have access, but the work is being done to connect them to the appropriate services. Because just having the access, it doesn't connect people to the appropriate services. Quality and population health management does.
But that runs us into another issue, again, having to do with the fact that we're the only major country not to have a national health care program. So somebody walks in and you make a diagnosis and say, well, sorry, you have breast cancer. Oh, but I can't afford the other treatment that I need, or I'm going to go medically bankrupt as a result. All right, who else wants to jump into the issue of the morality of providing health care to all people at a time when we lose? We don't talk about it very much, but studies that I have seen suggest that we lose over 60,000 people a year who don't get to a doctor on time, and that if we don't treat people, you said it, an ounce of prevention is better than a pound of cure. Are we spending on the cure, the tertiary health care, the $100,000 surgeries, rather than making sure people have the medicine and the primary health care they need? Amanda?
So I appreciate you putting it in that context, and I will just call out some of the comments that Senator Cassidy made earlier, that this is the wise investment. And to your point, it is about keeping people healthy. So if you keep them healthy on the front end, if you keep them out of the emergency room, if you keep their chronic diseases managed, if you keep them from getting severely ill, which you can do in health centers, yes, it is going to serve, and it is meaningful for the 100 million people that we've called out today, but really for everyone. Primary care is the path to success in healthcare.
Good morning, friends. Happy Monday to all of you. New checks are being deposited right now. I know many of you are wondering, who qualifies for a fourth stimulus check this year? So in today's video, I will be sharing with you which states and cities have confirmed the arrival of new payments starting this month. There are also different qualifications depending on which state you reside in. So please make sure that you watch until the end of this video. Also, this coming Friday, I will be announcing 2 more winners for the Walmart gift card giveaway. If you would like to enter the weekly giveaway, friends, all you have to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you watch and then comment on, the greater your chances, my friends, of winning the giveaways. While inflation has fallen for several months, prices today remain on average 6% higher than those paid by consumers 1 year ago. To help residents keep up with inflation, 3 states are providing direct relief. Starting a few weeks ago, the state of Connecticut began making direct payments to some residents to support them to combat inflation and thanked them for their brave service during the crisis. The state's comptroller, Sean Scanlon, announced that around 150,000 essential workers were eligible to receive up to $1,000 through the Premium Pay program. Sean Scanlon said in an official statement, "During the crisis, Connecticut's frontline workers stepped up and kept our grocery stores open, our hospitals operational, our community safe. The government sees the payments as one small way we can thank them." So friends, to receive a payment, you must have worked as an essential worker in Connecticut for the entirety of the time between March 10, 2020 and May 7, 2022. Additionally, no remote or public sector workers are eligible. You must also have worked in a job categorized by the CDC as 1A or 1B in a role where you made $149,999 or less. The first batch of direct deposit payments were sent to around 120,000 workers, and it was sent in February. An additional 35,000 checks were sent through the mail, which should arrive any day now, as the state assumed it would take them between 5 to 6 weeks to get the payments out the door. Also, in the state of Idaho, property owners may qualify for relief under the state's property tax reduction program. Once eligible, homeowners and those who resided in the state in 2022 may see their property tax bill fall anywhere between $250 and $1,500. To qualify for this tax credit, one's 2022 income must have been equal to or less than $33,870. Additionally, the state will only be allowing those who owned and lived in a home in Idaho, and that was their primary residence before April 15, 2023. According to state officials, an application must be sent in order to receive the credit. The application can be obtained from one's county assessor's office or through the Idaho State Tax Commission. Once approved, you will see the deduction on your December 2023 property tax bill. So when applying, you will need to provide the state with your income, proof that you fall into one of the qualifying groups, and proof of home ownership. One other state with plans to provide extra financial aid to their residents is New Mexico. New Mexico's legislature passed a $1.1 billion tax relief package. Lawmakers tapped a financial windfall from oil production in efforts to break through cycles of poverty, with tax refunds to working families with children and reduced tax rates. The House gave final approval on a voice vote to an array of tax changes, including $500 individual rebates and tax credits of up to $600 per child. Well, my dearest and amazing friends, that is the end of my daily stimulus update video for today. Thank you so much, friends, for being part of this community. To say thank you, I will be announcing 2 winners for the Walmart gift card giveaway. If you would like to enter the giveaway, friends, simply click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, my friends, the greater your chances of winning the giveaways. Thank you and have a wonderful and very blessed week.